Welcome to the 3D Heart Project series of videos. My name is Carolina Escudero, and I am a pediatric cardiologist at the Stollery Children's Hospital in Edmonton. Today, I'm going to go through the anatomy of hypoplastic left heart syndrome and the first stage of the single ventricle palliation for this condition. The word hypoplastic means that the area is underdeveloped or small. So hypoplastic left heart syndrome refers to a small left side of the heart. When we say palliation, we mean that this surgery cannot repair the condition, but instead allows blood to flow differently. This first surgery for hypoplastic left heart syndrome is called the Norwood procedure. This surgery would take place within the first few days to weeks of life. Before watching this video, we would recommend to watch our video on the normal anatomy of the heart through the link provided below. We also have a glossary of definitions for this video available on the website. The models will be shown to you as if you are looking at the heart inside the body of someone in front of you. Each 3D model of the heart can be made to show either the muscle of the heart or the blood that is contained within the chambers of the heart. Today, we are going to be using a model that shows the blood inside the chambers of the heart, which is called a blood pool model. This type of model is used to show what the blood inside the heart chambers looks like, which gives a clear idea of the size of each part of the heart. We can also see the blood in the important blood vessels that connect to and from the heart. I'm going to start with a model of the normal heart. This heart would sit in the chest, something like this. Here in the blue, you can see the right side of the heart, and here in the red, you can see the left side of the heart. The important part to notice is that the right ventricle or pumping chamber in blue and the left ventricle or pumping chamber in red are about the same size in the typical or normal heart. In hypoplastic left heart syndrome, the left side of the heart is much smaller than it should be. The word hypoplastic means that the area is small or underdeveloped. Hypoplastic left heart syndrome occurs when the mitral valve, located here, the left ventricle, the aortic valve, located in here, and the aorta are much smaller than they should be. When we compare the model of the typical heart with the model of a heart with hypoplastic left heart syndrome after a Norwood procedure, you can see that these models look very different. Looking at them side by side and comparing the left versus the right side, you can immediately see that the right side is proportionally similar in size between the two models, but the left side of the heart, seen in red in both models, is tiny in the heart with hypoplastic left heart syndrome. Here we see our 3D model of a heart with hypoplastic left heart syndrome after the Norwood procedure. This model would sit in the chest, something like this. Remember that this is a blood pool model, so what we are seeing is what the blood looks like inside the heart. This model is colored in blue to represent the deoxygenated or oxygen-poor blood, red to indicate the oxygenated or oxygen-rich blood, and in purple to represent when the red and blue blood mix to give partially oxygenated blood. Hypoplastic left heart syndrome describes any combination of features that results in a very small left side of the heart. This means that the mitral valve, which would be located here, the left ventricle, located here, the aortic valve and the aorta are underdeveloped or absent. The problem with hypoplastic left heart syndrome is that the heart cannot get enough blood to the body because the left side of the heart is too small. These babies need ICU care and surgery to survive. In this model of hypoplastic left heart syndrome, the mitral valve, located here, is very small, and the left ventricle is tiny when you compare it to the much larger right ventricle. This left ventricle is far too small to be able to pump the oxygenated blood to the body. So this heart demonstrates what we call a functionally univentricular heart, or a single ventricle heart, meaning that there is only one ventricle, in this case the right ventricle, that would be able to pump blood out of the heart effectively. The aorta is also tiny and can be seen just in the middle of this heart model. If we compare this heart model to the normal heart, we can see just how much smaller these structures are in hypoplastic left heart syndrome. This heart has undergone a Norwood procedure, which is the first surgery used to treat a child with hypoplastic left heart syndrome. The Norwood procedure has a few goals. The first goal is to allow the single ventricle or pumping chamber, that's the right ventricle located here, to be able to pump blood to the body. The second goal is to create a way for the blood to also get to the lungs so that similar amounts of blood can go to the lungs and to the body. Another goal of the procedure is to allow the blood to freely flow from the left to the right side of the heart. For additional resources on the Norwood procedure, please visit our website. The Norwood surgery involves 3 main steps. Firstly, the pulmonary valve and the main pulmonary artery are converted from pumping blood to the lungs to pumping blood to the body. This is done by disconnecting the branch pulmonary arteries, located here, from the main pulmonary artery, located here. The main pulmonary artery is then connected to and used to help rebuild the aorta, as you can see here. This new aorta is called the neo-aorta, which means new aorta. The old aorta is the tiny structure located here and is connected to the neo-aorta in order to allow the blood being pumped to the body to also be able to travel to the coronary arteries located here, which supply the heart muscle itself with blood. At this stage, the heart has a way to pump blood to the body using the right ventricle through this new or neo aorta, and now we need to find a way to pump blood to the lungs. The next step is to find a way to get blood to the lungs. This is done by connecting a shunt or tube to the disconnected pulmonary arteries. There are 2 common methods to get blood to the lungs. The Blaylock-Thomas-Towsing, or BTT shunt, connects a tube that comes off the branches of the aorta and attaches to the pulmonary arteries. This tube would be located here and then attached to the pulmonary arteries. This model does not show the BTT shunt, but it would be connected here. The other common way is to use a tube called a Sano shunt, which is seen in this model. This is the Sano shunt. It is a tube that was surgically placed to connect the right ventricle, located here, to the pulmonary arteries, as we can see in the back. This is also called a right ventricular to pulmonary artery conduit, which is often shortened to RV, right ventricle, to pulmonary artery, or PA, conduit. This term describes the connection that this tube makes between the right ventricle and the pulmonary arteries. At this stage, now the right ventricle can pump blood to the body via the neo-aorta or new aorta, but the right ventricle can also pump blood through this Sano shunt to the pulmonary arteries to supply the lungs. The last step is to make sure that the blood can flow freely between the left atrium, located here in red, and the right atrium. This may involve removing the atrial septum. Remember that the atrial septum is the wall between the right and left atria. Removing this wall is called an atrial septectomy and is done to allow free flow of red oxygenated blood into the right atrium. The Norwood procedure is a complex procedure and may be difficult to understand. Let's follow the blood flow through the heart to help us better understand how the Norwood procedure has allowed the heart to function with only one ventricle or pumping chamber. Please make sure that you have watched our video on the normal heart to understand how the blood typically flows through the heart. In both the normal heart and the heart that has had a Norwood procedure, the deoxygenated or blue blood from the body travels to the right atrium, located here, through the superior vena cava and the inferior vena cava to enter the right atrium, located here. In the heart with a Norwood procedure, the right atrium also has oxygenated or red blood entering through the hole between the left and the right atria. The red oxygenated blood and the blue deoxygenated blood mix in the right atrium to make this purple or partially oxygenated blood. The blood then travels through the tricuspid valve, located here, and travels into the right ventricle or the main pumping chamber. Once reaching the right ventricle, the blood can then either go through the neo-aortic valve and the neo-aorta to go to the body, or can go through the sano-shunt to enter the lungs. How much blood flows either to the body or to the lungs depends on many factors, including the size of the connections to the body and the lungs, and the blood pressures in the lungs compared to the body. In the heart with the Norwood procedure, we want approximately equal amounts of blood to go to the lungs through the sano-shunt and to the body through the neo-aorta. Notice that this purple, partially oxygenated blood is what is heading to the body. This is why patients with a Norwood procedure have lower oxygen levels. These children will typically have oxygen saturations of 75 to 85%, which is lower than the saturations in children without heart disease, which should be above 95%. This is why children with a Norwood procedure may appear more blue, particularly in the face, hands, and feet. After returning from the lungs, the blood has picked up more oxygen so that it is oxygenated or oxygen-rich blood. This blood indicated in red that comes back from the lungs through the pulmonary veins located here in red. These pulmonary veins then lead to the left atrium located here. Blood from the left atrium can then travel through the small left side and through that mitral valve and into the left ventricle. In this particular heart, you can see that the blood can travel through the mitral valve and into the left ventricle, but then it has nowhere to leave the heart, as the left ventricle is tiny, and in this heart is not connected to the aorta. In this case, this tiny left ventricle is serving as a dead end for the path of blood. Instead, the blood in the left atrium is going to travel through the hole in the atrial septum, or the wall between the right and left atrium, to enter into the right atrium and then enter the right ventricle, as we talked about earlier. Let's review the anatomy of hypoplastic left heart syndrome and a heart with the Norwood procedure and a Sano shunt. In hypoplastic left heart syndrome, the left-sided structures, located here in red, including the mitral valve, the left ventricle, and the aorta, are either very small or may not be present. This means that the left side of the heart is not able to pump blood to the body, leaving the heart with only a single or functionally univentricular heart. In this case, the single ventricle is the right ventricle that can pump blood out of the heart. In order for these children to survive, a Norwood procedure is performed. In this heart with a Sano shunt, this allows the right ventricle, here in purple, to be able to pump the blood to the body and to the lungs. The deoxygenated blue blood from the body enters the right atrium through the superior and inferior vena cava. The red oxygenated blood coming back from the lungs enters the left atrium through the pulmonary veins, but can't get out the tiny left ventricle. So this blood must pass through a hole to enter the right atrium. The blue and red blood mix in the right atrium. Here's the blue and red blood. They mix in the right atrium to form partially oxygenated or this purple blood that enters into the right ventricle. The right ventricle is the only effective pumping chamber this heart has. The right ventricle then pumps the blood both to the body through the neo or new aorta and to the lungs through the Sano shunt. Thank you for watching our video on hypoplastic left heart syndrome and the Norwood procedure. This is a very complex procedure, and you may wish to watch this video again or to review our other content at 3dheartproject.com to better understand this or other similar heart defects. The procedures that would typically occur after the Norwood procedure include the Glenn and Fontan procedures. There are additional videos on each of these procedures also available on the website. Thanks again for watching.